Hey ladies, this is Mocha Mommy here bringing you another video, and this is part 2 of how you can advocate for your own reproductive health. The first thing to do is to start journaling, keeping track of your period, irregular bowel movements, any kind of stomach pain, acid reflux, anything at all could possibly help you to keep track and give your doctor a clear and accurate history of the things that are bothering and irritating you. Listen, every condition from allergies to asthma to eczema can all be linked to inflammation. And those underlying inflammatory conditions are some of the things that can lead to other problems in your reproductive health. Monitoring your period as well as your diet is going to be probably one of the most important things. 80% of your medical diagnoses come from your medical histories. So make sure you're keeping your track and keeping accurate documentation of any symptoms that seem to be disrupting your life in any way. The second thing that you can do in order to maintain positive outcomes in your reproductive health is by doing your best to maintain a healthy weight. I know that this is a huge struggle for so many of us, but fat cells and adipose tissue do increase the amounts of estrogen in your body, and that could possibly impact your responses to hormonal birth control. It could also make fertility treatments a lot more challenging, as well as just medications overall to treat chronic conditions. So ladies, doing your best to maintain a healthy body weight is one of the best things that you can do for your own reproductive health. Eating healthier and more organic can also impact our overall reproductive health. And shout out to content creator Gwen Vo, who on her blog talked about the presence of endocrine disruptors in common household goods, cosmetics, and hygiene products. Being conscious of what we put in and on our bodies can help us with our overall reproductive health. Another thing that you can do to protect your overall reproductive health is set money aside to invest in your health. Health insurance plans, Medicaid, are not going to cover what it was that they used to. They're also finding that a lot more of the specialty doctors, a lot more of the higher rated healthcare professionals are really leaving the system that don't compensate them well. So if you want to have access to the best, you're going to have to come out of pocket. Things like flex spending, health savings accounts are a really good idea to start putting money aside in order to invest in your health. Things are not going to be covered as comprehensively as they once were before. And I'm afraid that we may not go back to those days where small premiums and low pay coverage is going to be good or comprehensive enough. We in 2023 need to invest in our health, and that means investing in it financially. Another thing that can help you with your reproductive health is education and advocacy. We all need to have better communications with our physicians. We can't expect them to know everything, and we can't expect them to be the only authority when it comes to our overall healthcare life. We should feel comfortable asking for second opinions. We should feel comfortable using online pharmacies as well as at-home testing kits, and then comparing that and contrasting that with doctors' results. When we want a specific prescription for a specific condition that we're concerned about, we can't be afraid to bring in the NDC number or the exact type of forms that will help us financially afford the medications that we really want access to. We can't just assume that every doctor knows everything. We are going to have to self-advocate. I'm going to be honest with you, as a healthcare professional, if certain medications don't come from the big five, I'm talking Eli Lilly, GlaxoSmithKline, Merck, Johnson & Johnson, just those big, huge Pfizer, the big pharmaceutical companies, a lot of times we don't know about it. They're the ones who talk to us. They're the ones who advocate for us. They're the ones who give us free samples. And a lot of times, some of these smaller up and coming pharmacies, they don't give us a lot of that information. I just found out that there's a new emergency contraceptive pill that's created by a Black woman. A fantastic resource for both you and your healthcare provider has to be the wave of online pharmacies. They have been nothing short of a blessing to me and the people in my profession, because not only when a prescription is not covered by insurance or gets kicked back by an insurance company or medical billing, those online pharmacies will call the healthcare provider and walk you through the process to make sure that you can get the patient their medication at an affordable level, so you're not dealing with the medication noncompliance and all of the complications that come with it. And they do a much better job than some of the big box pharmacies like CVS, like Walgreens. And the website Healthline, honestly, it's a lot better than just typing in things to Google, because those articles are all reviewed by medical professionals. The online pharmacies are ranked actually by a Black woman who is a pharmacist as far as ease of use and comprehensiveness of coverage. They also have an article written by someone who has a PhD in maternal child health nursing care for online pharmacies that are really great for birth control methods. So ladies, definitely check out healthline.com. I will put it in the description box. I will also leave a link to my own reproductive health playlist that I'll be adding to and adding information to, so you ladies can stay updated. Also, I have a discount code that I will be posting in the description box for an online pharmacy for $20 off your first prescription. And let me tell you, those are some of the best resources for not just prescription drugs, but also for things like at-home testing kits, and even just getting on-call questions and answers for any health conditions that you may be struggling with. So ladies, this is Mocha Mommy wishing you the best of health from this day forward. I'll catch you in the next video.